Hi, I'm Caroline. I'm a trained doula with Birth Prep Doulas. In this video, I'm going to be continuing my discussion on epidurals. I'm going to talk about the risks and the benefits, the pros and cons of epidurals. So we'll start with the pros of getting an epidural. The most famous one is pain relief. But on top of getting the pain relief, epidurals give you pain relief without altering your mental state. So it's regional. It affects the nerves of the lower region of your body and numbs that. So you are able to get some relief from your pain, but you're also able to be present in the birth and laboring and delivery of your beautiful baby. And then the second benefit is that it allows for rest and stress relief. It depends on how long your labor has been. It depends on your capacity to handle your contractions. It depends on your personality too and how you handle pain. But some women experience so much stress that it is better for the edge of the pain to be taken away so that the stress and the stress hormones not interrupt the birth process. So epidurals provide women with that, and then you are able to get some rest if you are getting exhausted and let your body just continue doing what it already does naturally on its own. If you're going to end up receiving Pitocin, which is a drug that enhances the contractions. If you have an epidural in, Pitocin enhances the contractions, and because it enhances the contractions, they feel more intense. There's more pain, there's more discomfort. If you have an epidural in, then that also takes the edge, a lot of the edge out of that. Another thing is if you end up, for some reason, having a cesarean section, if you have an epidural, then you are able to be alert and awake and participate in the welcoming of your loved one into the world. Another thing that epidurals are known for is for women that had made the informed choice that they wanted to have an epidural. They feel more satisfied with their birth experience if they do receive an epidural. So those are the pros of getting an epidural. The risks, the cons of getting an epidural are, for one, epidurals, just because of the fact that they numb the nerves of the lower region of your body, which is where your uterus is located. They have been known to slow down the process of labor a little bit. This could come with its own challenges too. You also have limited positions. Once you get an epidural, you cannot really feel your legs at all, or not very much. So a lot of times you are discouraged from trying to get out of the bed at all without assistance. And also turning and repositioning in the bed, you are going to need help. So if you have a doula, this becomes very beneficial because there are positions that you can take when you have an epidural in that actually help the progress of labor, that employ the widening of the pelvic region, which is very important to allow for the baby to come out, and also just changing positions is very helpful in helping the baby get into the right position to come out of the birth canal, and employing gravity. So your doula can help you change positions, but those positions are still limited. Another thing that could happen is it increases your chances that you may need interventions like Pitocin, or when it comes to pushing, because you're not feeling your contractions very, very well, you might not know when to push. So your nurses and your doula, your provider, we're going to help you know when to push, but this is another challenge too. It also increases your chances that you might need the baby to be vacuum extracted or the use of forceps, because again, you're not feeling you're pushing very well. It might not be very effective, and those muscles down there, you don't have very much control of them anymore. Some women have reported that after they got an epidural, they were very, very shivery, ringing ears, backache, soreness, nausea. Any of these symptoms that come up, tell your nurse, and sometimes there are interventions that they can do right away to help you get some relief from these symptoms. And then the the baby could also get a little bit lethargic, just from the effect of the epidural, and have a little bit of trouble getting into the right position. And also, some people have reported that the baby seemed so lethargic that they were having trouble latching when it came to attempting breastfeeding. And then, very, very rare, less than 1% of people have complained that they got a very severe headache after they had an epidural. There is a treatment for that. It's called a blood patch, and it's a very, very rare side effect. And then another very, very rare side effect is nerve damage to the spinal cord, because the spinal cord is very sensitive. So there's always that risk when you're working in that area that there could be some nerves interrupted. So those are the risks of getting an epidural. So I hope this information helps you make an informed and confident choice. And I'd be happy to talk more about this topic or any other topic. And I wish you all the best. Thank you for your time and have a good day. Bye-bye.